Hey everyone, welcome back to the channel. My name is Kelly Troutman. I am a certified hand therapist. Today's video is one of my most asked questions. It's the question that I tend to get a lot when I'm treating patients, and it's something that I'm actually very passionate about because I have actually been through it before. So something that people ask me a lot is how to continue with weightlifting or exercises when you have tennis elbow. But today I'm going to talk you through some of the weighted exercises that you can do and some of the exercises that you probably should avoid while you're healing your tennis elbow pathology. So yeah, let's get into it. So first things first, what is tennis elbow? Obviously, if you have tennis elbow, you know that you have pain right here at the lateral epicondyle. You can see, if I turn it this way, see where that bone kind of sticks up there? That is your lateral epicondyle. The common tendon origin is actually right here below it, and that links these muscles, your extensor muscles, to the elbow. So something that is a common misconception is that the pain is at the elbow. So why are we controlling the wrist movement, or why are we worried about the wrist so much? Well, it's because those muscles that are affected here at the elbow are actually wrist extensor muscles. And you can see that as I'm extending my wrist back, do you see how that muscle engages and fires? So to protect your elbow and to help the pain at the elbow getting better, we need to focus on controlling your wrist. Does that make sense? Essentially, lateral epicondylitis or tennis elbow is a tendinopathy that is occurring at the common wrist extensor tendon origin on the lateral epicondyle and that common extensor tendon. It is micro tearing of the tendon that doesn't heal in between, so it over time becomes this really aggravating pathology, and it can last forever, and it really sucks to have. I actually had it about 3 years ago now. For me, it took about 1.5 years for it to get kind of to the point where I didn't notice it every day. But I also wasn't very good about doing my exercises and stretches. Anyway, that's not what you're here for. We're gonna do some exercises, and I'm gonna show you some do's and don'ts. In other words, some exercises to avoid and some exercises that might be more safe for you to do while you're healing from tennis elbow. Strengthening actually can be very helpful. You do need to kind of figure out what phase of the injury you're in. If you're in the very acute phase, meaning that you've just got this injury, it's really aggravated, it's really irritated, it's probably a lot of swelling like internally in that area, it just feels achy all the time, painful all the time. You are probably not going to want to do weightlifting right away. I would give it a few weeks of rest. Try not to do a lot of lifting during your daily activities even, so carrying groceries and stuff like that. Don't hold things in your hand if you can help it. If you are kind of past that phase, you've had it on and off for a little while, it's kind of seeming like it's settled down a little bit, you might be ready to start getting back into some exercises. You don't want to not do any weightlifting or any exercising, right? Because you don't want your muscles to get deconditioned, which will actually make things worse. So you just have to kind of figure out where you're at in the phase of this injury, and you might check with your doctor, a hand specialist, or a rehab professional, and they might be able to help guide you and kind of figure out what might be the best treatment for you at the stage that you're at. So that's just a little disclaimer. Let's get into some do's and don'ts. So the first set of exercises that you will probably want to avoid while you're dealing with tennis elbow symptoms are doing all or none or full body weight exercises. So I'm talking chin-ups, pull-ups, push-ups, anything like that, tricep dips, anything where you cannot adjust the weight and you're having to take on an all or none load, that's going to be too much strain on your elbow. So kind of take that back for a while. Don't do a lot of push-ups. Try not to do any chin-ups, whatever. I don't tend to like to do those exercises anyway, but if that's something that you enjoy, kind of cut it out of your workout regime for now. You will be able to add it back in later. But basically, when you can't adjust the amount of weight on the body, you're putting more strain into that tendon. So definitely avoid those for now. The next exercise that you will want to avoid are doing things with an extended arm, meaning the elbow is straight, and especially in the palm down position. So this is going to apply to things like your lateral raises, like your frontal raises. Those kind of exercises are extremely aggravating and too much load on the wrist extensor muscles. It's a long lever arm, meaning that the weight is out far away and it's putting a lot of strain into that muscle. It is best if you don't do these exercises at all while you're dealing with tennis elbow, but if you're getting into the later phases and you're wanting to build that strength back up, or if you absolutely must do these exercises, modify the positioning to have a 90-degree angle of elbow flexion here. So bend the elbow and then continue to do the exercise this direction. Always make sure that you're controlling the exercise as you bring it down. Same thing going into a frontal raise. If you keep, it's too heavy for me, if you keep the elbow bent, it's going to be a lot less strain than if you have your elbow straight. Does that make sense? You never knew I was going to work out for you. Another exercise that probably should be avoided when you're dealing with tennis elbow symptoms is doing the upright row positioning. So let me just grab my weights and I will show you what that looks like if you're not familiar. So an upright row is pulling the arms up and then lowering them back down. This movement, again, is very aggravating for your elbow. It's also kind of difficult for your shoulder. The AC joint gets kind of like jammed in that position. So it's just not really my favorite type of exercise, but I see a lot of people doing this, or I did see a lot of people in the gym doing this pre-COVID, of course. If you want to do a rowing position, it's actually better just to do like a bent over row, keeping your back flat and then rowing the arms back and getting a little squeeze there. That's going to be much easier for you for your tennis elbow. It's like you're going to be a lot less strain. I forgot how to talk for a second there. It's a lot less strain on your elbow, and it's also better for your shoulders as well. So that's my recommendation with upright rows. Cut that out. A lot of people like to do bicep curls in the gym, and that is a great exercise. It can really help to strengthen some of the proximal muscles, of course, and of course your biceps are a big part of that. You definitely don't want to do them in a reverse position with the palm down, right? So again, palm down, a lot more strain on that elbow. So you don't want to do your reverse curls, okay? No reverse bicep curls right now for you. The easiest position, or the best, least strain position, is going to be palm up, just a standard curl like that. You can also upgrade that to a hammer curl, like in a neutral position. That's going to be slightly more strained. And then again, a little bit more strain on that is going to be a rotating curl, where your palm rotates up and down. So that might be a little bit too aggressive for you if you're in an earlier phase of treatment. You might want to just start with your normal standard curl and go from there. So the next exercise that I'm going to show you is typically something that you would do with a cable machine. I don't have that at home, and since we're in COVID, we're not at the gym, so I'm going to show it to you with a dumbbell. But typically this exercise is called the wood chop exercise. So you're going to have both hands together. You'd be holding the cable, you're bringing them up over one shoulder and then down across the body, right? Like that little crisscrossy exercise. That's just going to be real aggravating on the elbow because, again, you're rotating into that prone position, your elbow's extended. With the weight, it looks something like this. I'm getting my workout in today doing this video. You're watching me struggle through weights that are too heavy for me because I'm too lazy to switch the dumbbells down to a lower weight. Okay, so definitely avoid that exercise if you can. There are going to be certain exercises on the cable machine that you do better with than others. You just have to play with it and see what feels best for you. Again, trying to avoid long arm levers, like with the extended elbow, with the palm down especially. Sometimes you can do it with the palm up. You just have to see what works best for you. But certainly doing things like lateral row, lat pull down, like rowing down with both arms overhead is going to be okay. Sometimes doing like a straight back row or like again a bent over row, those kind of exercises might be fine. Cable curls, all those kind of things can be helpful. If you do some tricep exercises with the cables, that's fine. Just trying to avoid some of those like rotational movements, especially with an arm elbow extended and prone or palm down position. Now that we've covered the don'ts, let's talk about some of the do's or some of the tricks that can help you keep working out while you have tennis elbow. My personal opinion and what I used in my experience, the thing that helped me the most was actually using a Counterforce brace when I did weightlifting. It seemed a little bit weird at first. It took me a couple sessions to get used to it. I felt a little bit uncomfortable that I had this weird looking band around my elbow, but it actually helped me so much. I truly believe that is what made my tennis elbow get better, because I know I wasn't doing it what I was supposed to do for it, stretching and icing and all that jazz. Mine looks like this. It's very well used. I believe this is called the mat strap from Healy Weber. I like this one a lot. Bandit is another option that I've used before. I think it looks a little bit more like bulky and seems a little more uncomfortable. I like that this one is like a flexible material and not the Velcro directly on your skin. I know that Brace Lab also has a good version of a push brace, like for the elbow too, but it just slides on. You want to position it over the muscle wad about 3 fingers from the lateral epicondyle, and then you just pull it tight. It helps to disperse the forces going through that tendon, so it helps spread out the force and it takes some of the pressure off the lateral epicondyle and that common extensor tendon that's injured. So that helped me a lot. I used it while I was weightlifting, and then I would take it off and go about my day as normal. So I definitely recommend using a Counterforce brace, or you can try some kinesio tape. Some days when I wasn't having as much pain, I would just tape my elbow with kinesio tape, or any kind of like kinesiology tape works. You can find a bunch of tutorials on how to do that online. I would recommend Allison Taylor. She's just like honestly a tape goddess. So I would look for her YouTube channel and kind of find some, I'll link it below for you, but she has a lot of videos out there too for taping, so you can try taping. That's really helpful, just some sort of support while you're lifting. The next do is always warm up before you do any sort of lifting or exercises. We should be doing this normally, but I know that most of us don't. It's good to warm up your shoulders, doing some shoulder circles. Sorry, I didn't want to hit the wall there. You can do some external rotation warm-ups, where you're just kind of getting that capsule greased, getting those muscles engaged, ready to go, so that you're not overusing the arms. Between your sets, make sure that you're doing some forearm stretches. It'll feel really good if you do it. You'll know that you need to do it every couple sets or so. It'll help you a lot in the long run. So definitely make sure that you're warming up before you exercise. Make sure that you're stretching in between sets of your exercises, and then definitely after you finish at the gym as well. Those things will definitely help more than you think. My next tip is to lower the weight. Don't let your ego get in the way. You have an injury, you have a reason why you can't be performing at like this outstanding level, and nobody's looking at you anyway. Like, to be honest, everybody's in the gym just doing their own thing, or everyone's at your home gym doing their own thing. Don't worry about other people. Get your headphones on, lower the weights, and don't worry about it. You're doing the best for your body. If you lower the weights for a while and maybe you increase the reps a little bit, you're actually going to build strength up without injuring the tendon more, and so gradually you'll be able to progressively overload the muscles again like you normally would. So definitely lower the weight. Don't go all out. Don't do your max, and take it from there. Another tip with weightlifting, but also with just daily activities as well, is do try to keep your wrist in a neutral position as much as possible while you're lifting. You don't want your wrist to be extended a lot. You don't want your wrist to be flexed a lot. Try and keep it nice and straight as much as you possibly can. That goes for all daily activities as well. It's going to put less strain on your tendons. My last do is a simple one, and you probably could have guessed it, but I'm guessing that you don't normally do it because I never did. Use ice when you get home from the gym. Put an ice pack on your elbow for 10 minutes after you're done working out, and then be done with it. I know that most of you probably aren't doing that because it's a pain in the butt and it's cold and it's like winter now, so we don't want to feel like extra cold. It seems like just one extra thing we have to do, but take care of your body and it will take care of you back. If you do the ice, it will help your body calm down after that workout session. It will reduce any acute inflammation that's come into the area after straining the muscles. And over time, your elbow will start to heal. So put the ice on, it'll help your pain, it'll help you not be sore, and it'll help your body heal. Okay, so those are some of my basic do's and don'ts when it comes to weightlifting with tennis elbow. I hope that this video is helpful for you. If you have any additional tips or tricks, or if you have comments or questions, please leave those below. I will respond to all of them. Thank you guys so much for watching this video. Thank you for your support. If you enjoyed the video, please give it a thumbs up. Don't forget to subscribe to the channel so you don't miss any more hand therapy videos. And I'll see you guys in the next one.